Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Hi, welcome to Health Impact's Digital Health Talks podcast, where we explore the latest innovations and trends in the world of digital health. I'm your host, Megan Antonelli, and I'm thrilled to have an exceptional guest with us today. Joining me is Nzinga Lowe, the visionary CEO and founder of Pygmalion Health. Nzinga is a trailblazer in the industry, and her company is at the forefront of revolutionizing healthcare through value-based care. Get ready for an insightful and engaging discussion. In this interview, Nzinga and I will talk about her extensive experience in value-based care and digital health, and we'll discuss the challenges and opportunities driving value-based care adoption among providers and payers. Hi, Nzinga. Thanks for being here.
Hey, it's so great to be here, Megan. Thank you so much.
I'm so glad we connected and, learning about your journey to this space. I worked with payers for a long time and I have a deep interest and passion around value-based care, but I want to see it work and I want to see it come to pass, whatever we call it. I want to see fee for service go away and for people to be incentivized the right way within healthcare. And I think that those incentives are often what gets us in the way of real progress. So tell me your story and how you came to start Pygmalion Health.
Yeah, so interesting story that took a lot of twists and turns. I originally went to school for pre-med, and that was the focus. And then I started working in college as a donor and transplant coordinator. So both determining the readiness of tissue to be used in transplant and research cases, as well as extracting tissue. And met up with some amazing executives within the hospital space and ended up connecting with an MSO who brought me in to be their HEDIS consultant. And I come in, I'm like, well, what the hell is HEDIS, right? I don't know. So from there, that's when I built it up. I learned it, started working with, Florida Blue, Humana, a lot of groups in the space. And from there, that trajectory took me to work with ophthalmology-based MSOs, primary care-based MSOs, growing those networks, even growing CINs, clinically integrated networks, and really just building up primary care providers to operate more in a culturally competent way, increase health equity, and truly succeed in value-based care. And that's what brought me to Pygmalion Health. I wanted to make sure that primary care providers had a space where they could gain the autonomy they need. When we think about good healthcare and where that was when providers knew you by first name, knew your children, were coming to the house or on a phone call and could diagnose you and treat you just because they knew you very well. Helping providers get back to that space where they're equipped with the resources they need, the partners they need, so that their focus is solely on patient care and not burnt out and exhausted from how the healthcare system does not support them.
Yeah, well, and that's such a critical piece of this, right? And with the changes that are constantly happening at that practice level, to some degree, they came in to give care and to take care of patients. Yeah. And HEDIS scores and the administrative burden around what it really means to be a practice leader these days, is a lot. So tell me about some of the things you see there, because we deal at Health Impact, we talk a lot with obviously big health systems that are making those big investments and have been in terms of, their Epic and Cerner and Oracle systems since for years now, right? Tell us what you're seeing at that practice level in terms of their digital readiness and some of the factors that they're considering.
Yeah, great question. I think for digital readiness, what I'm seeing is that a lot of independent providers or medical groups that operate very well within the community may not know what digital solutions are out there, but they really, like you said, with that readiness, what that looks like for them before they can even go into these solutions is understanding what digital health is and what it isn't. because most of the time they're looking for a solution that's going to solve all their problems or the shiny new thing, because that's what's being advertised. When they do find out about the solutions out there, they're hearing about how, oh yeah, no, this is going to solve everything. And it might solve everything for one person, but not for you. So when I try to work with these groups and helping them understand what readiness looks like, it's about a clear understanding of their needs and a growth plan, and making sure that they actually have the infrastructure and technical teams to really support the adoption of any of their digital health solutions from EHR and beyond, right?
Sure.
And also the true comprehension, like I said, of solutions, understanding what you need in your market. So if you know you operate within an urban and a rural market, you know that health equity is going to be a key solution for you. So the digital health solutions that you operate with or connect with need to be tied to that. If you know that you require more health literacy, but a lot of your patients have access to phones and other forms of digital support, driving a digital health partner or increasing digital health literacy initiatives will be key. So it's all about understanding, are you guys ready? Does it align with your needs, with your growth plan, knowing your market? Also, the provider's comfortability. The great thing about providers is that they have a healthy skepticism. So they are always ready to tell partners how they can actually grow, better serve them, and better be better. So I think that is a healthy mindset to have when it comes to digital health.
Right.
And then even what dedicated training and support teams can be present and timeline to deploy. I think when we think of digital health being this great tool and providing so much ease and efficiency, the timeline to deploy and to actually get comfortable with it, you have to go through the bad before you can get to the good. So making sure that a lot of those groups know what it's going to take for things to actually get to that seamless process. And the same thing can be said about value-based care, right? It takes time before you start to see success, especially when you are adopting the right partners in there. Your care team needs the key patient information, understanding the market you occupy. Do you have a high, Medicare Advantage population, a high senior population? What do digital health solutions look like for them? Do they have a great connection with children and grandchildren? Can they start to get them comfortable with these solutions?
Right.
And you have to know and live and breathe your data. I always tell clients that that's how you know what solution and what partner is for you.
Yeah. When it comes to the physicians, providers that you're meeting with, are you seeing, in terms of, when I think back to when I started, where you sort of imagine maybe an older male who's perhaps not as tech savvy. I have to, at least in my optimistic view of the world, that there's the physicians are coming out of medical school ready, more digitally savvy nowadays, right? You mentioned the skepticism, and it's like they've just invested a tremendous amount in their education and in getting through this. Now we tell them, oh, and you need to buy all of these systems and practices and and have the support staff to manage this. I mean, what is that conversation like in terms of getting them to understand that this is a significant investment? Or are you finding that they come ready and knowing that that's part of running this business?
Yeah, I think, and that's actually an interesting topic. At the conference that I just spoke at, there was a student just getting out of residency, actually a physician getting out of residency, and saying, you learn how to care for patients, but you don't know how to deliver care. You're never trained in that. So you understand, digital health, you understand the advancements that are happening within the space, but not what that looks like from a payer side, not what it looks like from you keeping doors open for your practice, how to implement it from an administrative standpoint, not just clinical. So I think for that is a bit of shock coming into a space thinking that, okay, I'm going to be treating patients, but also I have to keep my doors open. I have to partner with people. What I always like to say, mission and margin need to align. And you're not trained in that. You're not trained in the margin, you're trained in your mission, which is a beautiful thing. And then that's why it's key that providers have that support, because you
Right.
may be very tech savvy, but it's difficult operating in this space where no one warned you or gave you an understanding of the science or the business of healthcare.
Right, right.
Yeah.
The science of medicine is very different from the
Yes,
business of healthcare, right?
it is.
And where they're trained. If value-based care in some way, whether euphemistically so or not, it
Yes.
represents the business of healthcare and where it should go and could go. What is the provider readiness to understand what that is or even shift to it?
Yeah. For value-based care, I think when a lot of groups get into it, they think this is going to, because what is value-based care? You're seeing patients less, supporting them more, connecting them to resources, and preventing burnout. But
Mhm.
that takes time, right? When people say that value-based care is difficult, it is, because what you're doing is you're operating in value-based care with certain populations. You're going from a commercial standpoint where it's very lax, and then having to train patients and providers to be structured with that demographic. So those with, Medicare Advantage, right? So that's why I always say the main challenge is it takes time to succeed. You have to learn that things have to be structured. You're going from a patient that was told, okay, I'll see you once a year, to now I need to see you several times a year, especially if you have a chronic condition. I need you to get your screenings. I need you to stay up to date, get checked in, get a call, right? So it's a shock for the patient and the provider who's now operating in fee for service, Medicare Advantage, maybe ACO REACH, various programs. So it's confusing. They have so many metrics and benchmarks to maintain and oversee. And like I said, you have to be really bought in. You have to be comfortable with going through the rough parts before it starts to make sense. And I think that's really the big challenge overall for value-based care. If we're going to actually see true value, it needs to start from the beginning, right? It needs to be operating in Medicaid, right? And we now are starting to have managed Medicaid programs, but the same investment in Medicare Advantage needs to be made in Medicaid, because really, what is Medicare Advantage but a lot of Medicaid patients that aged in and became eligible and got their benefits? And even from the commercial side, making sure that patients start to build that autonomy. So that's what I'm seeing with the challenges of providers getting into value-based care and the various programs that are out there. And I think digital health really is a tool that enhances that. I know some people may think that digital health is a saving grace, or they try to get people to understand that. But I think it's a very clear thing that digital health will never be the end all be all. It is just that support that builds upon it, because digital health is ever evolving and it's definitely growing.
Right.
Yeah.
And we talk about it as a, sort of the transformation that's occurring. But of course, it's just a collection of many tools, right?
Yeah.
And where the EHR is maybe the foundational tool of that. And then it becomes what are the add-ons, the elements that bring it together. But with value-based care, basically what you're saying is provide more care, but we're going to pay you over a longer time and for the results that we see. Right. And so from a provider standpoint, that is, how do I do that in a world where they are very burnt out and over too much pressure and overtasked as it is, it becomes a complicated, endeavor. But in that, with AI and ambient listening and remote patient monitoring and some of these technologies that are just coming into the adoption, at a point where we can see their value and truly measure it, where physicians can in fact do more with less, because those tools are doing that. The EHR was not one of those. The EHR was do more and then do more. Do more and still care for your patients. Just record it all here. But these new technologies, and some aren't so new, but that are getting more rapidly adopted recently, are there to amplify the care work and make some of that work cheaper and just as good, right? So where are you seeing excitement from your providers? Where are you
Yeah.
seeing, more fears or trepidations or concerns around what some of these digital health solutions can do?
So obviously, I think we've all seen it, the conversations of AI scribe, like how detrimental will it be? But I think really how we see this digital partner, because digital health isn't going anywhere. Advancements in AI, they're not going anywhere, but we have to be mindful of who we partner with in terms of companies to make sure that they align with our mission as well. And that will start to wipe away some of the fears. But many people will argue, well, patients are against AI. I've heard some of those arguments, but we all have cell phones. We all have, smartphones. Our grandparents are using Facebook, right? They're connecting with us. So we're already active within this, tech-led community. I know that there are some communities, though, that may not have access to it, right? Like rural communities. So it's very key that we're making sure that even community partners are a part of that care continuum, because care doesn't happen in a vacuum. So I would say that's how we start to shift the focus. The champion approach is what I like to call it. Change happens and true transformation happens from the bottom up. When we see what our patients need, when we hear what our doctors need, that's when we're able to shape these tools. And digital health, again, it's a tool that enhances health literacy initiative. There are some amazing tools that increase health literacy or can connect patients to health literacy, to treatment plans and synchronous care, like digital therapeutics, which is putting the patient in the driver's seat, improving diabetes understanding. And that's another health literacy tool. Digital therapeutics, there's one app, and I can't think of the name of it, but it educates the patient with diabetes and how to improve and manage this condition through a game. So they're every level, they're learning something new. There's digital therapeutics in depression and social isolation, which can exacerbate certain medical conditions and disease states, and even in anxiety and cancer. So I think once we see that patients want to be a part of their care plans, because they truly are the owner of their plans. And we're seeing a lot of community organizations advancing how patients even connect with their providers. There are some community groups that are allowing patients to do telemed visits, in their spaces. And I think that's why we're seeing a lot more providers be bought in, because they know that advances the access to care, that enhances the treatments that that they're offering and that they're currently doing. And it also brings them into the full care continuum. I have so many providers that tell me, oh, I didn't know this patient was seeing this provider, didn't know that they were taking this medication, because sometimes you might not have access to that information, but digital health and AI is starting to bring that right to your doorstep, especially when it comes to managing open care gaps. If you're going to really take care of that patient, have it at point of care, right? The alerts around open screenings, RAP, and chronic conditions and HCCs that need to be reviewed. There are some amazing partners. Nzinga AI is one of them. That at point of care, you're finding out what open care gaps are there. That puts less stress on the provider who's in these value-based care programs and less stress on the patient, because they're not having to be called back and forth to come in for appointments for things that were missed. And then even from the pharmacological side with drugs, another patient-centric support that I'm seeing is DecisionRx. Jim Wallace and Travis Morgan, what they've created is amazing. I think their tagline is the most expensive drug is the one that doesn't work. And that couldn't be even more true. And what they're doing is they're making it so patient-centric. They're doing tests from a pharmacogenomics level, where they're actually learning how your body actually metabolizes their prescriptions. This is an amazing health tech startup that is helping to drive down ER visits, hospital stays, adverse reactions from medications, and even improve providers that are trying to understand how they're best treating these patients and supporting even that Part D spend, right, for the groups that may not be managed well or have access to the resources they need to understand what that full multidisciplinary level care looks like. So there are some amazing partners. That's just a few. But
Well, and that's, it's interesting. I mean, where you sit, because you sort of,
Yes.
you sit in that space between, where between providers and
Yeah.
payers, right?
Yes.
And so, and a lot of the time we talk about and talk with our, the startups and the innovators, and they kind of wonder, they make that decision. Well, are we really selling into the provider market? Are we selling into the payer market? And I think, what I'm hearing from you and what I've always thought is if you're not able to provide value to both, then you're probably not going to have a long-term plan.
Yeah.
I
Yeah.
mean, I think, I don't know I forget if it was Hallie Tecco or Chrissy Farr, but one of them talked about on their podcast recently, these healthcare innovators are either working from within the system or outside of the system, trying to disrupt the system from within or working within. And I guess it may be my age and it may be being a little bit more traditional, but I've watched a lot of people try to change healthcare. And it's really hard. So I'm always one for working within the system, because if you want to see the change happen in your lifetime, you're probably better off figuring out how to serve the stakeholders and putting the patient value first and foremost, right? If you impact care, if you impact the patient, well, then that patient is the customer to both the payer and the hospital and the health system or the provider. So if you make them happy, yes, you can make those two happy, but you've got to also make them happy and think about it, right? And it sounds like some of the technologies you're talking about do that. So talk a little bit about that space for you in terms of being that go-between or liaison between the payer and the provider, and what that means, what you see as kind of the future and kind of where things are right now.
Yeah, and I think just to speak on how you framed it, that is very key. I was at a conference, Reimagining Primary Care, and we were having a discussion where how we look at it, we always hear the provider is the quarterback, right? But no, the provider is actually the coach. And what is the patient? The patient is the owner. And the payer, how we should see it is that the payer is that sponsor, right? The fan who invests into the ongoing process of this team, right? And mind you, please don't look to me for football references. Everybody is a quarterback. Everybody is Michael Jordan, right? Go team. But I think that how we look at it is that how we create solutions, it needs to support everybody in that team. Putting those helps us to shape our value proposition and our offerings. So that's what I always say. If we're going to create a solution, it needs to be with what Pygmalion Health is doing. My focus is on making sure that the partners that I connect with, both the payers as well as the providers, are tailored to them. And it's all about making sure that everyone involved is in the community. They understand what the patients need. A lot of plans have that upper hand because whether you are a community health plan all the way to the largest group, you have a presence in the community. You're in the markets that you need to be, but that means actually going into those markets, connecting with those community organizations and churches. And I make that a big focus that everybody involved, whether I'm working with a health system, a medical group, or even a payer, you understand what resources you have available to you and how this market is in dire need of those solutions, right? And how you can advance your offerings to these patients. And I think that's where you start to see the biggest change, when you're able to show them from part A, B, or D, what is bringing you into the red? Where is there a deficit? Is it just within, the administrative burden, or is it actually within the performance across your full report of hospital to ancillary all the way to part D? But I'm seeing that by bringing them into a space where they're able to understand that care is happening even outside of just this payer landscape. Care is happening outside of the doctor's office. You have churches that are running food pantries where they're giving out healthy meals. Food is medicine and exercise is medicine is very key. It's very big where community organizations are taking a bigger stance and even health literacy. So that has also influenced a lot of physicians, connecting them to the right partners, which has brought payers into the space where they're understanding, even what we're offering. Behavioral health, that's been a big issue. And a lot of payers are now dedicating themselves to bring on behavioral health teams. patient advocates. There are a lot of plans that might be missing that patient advocate space, but it's time for that to be present. And I think a lot of groups are catching on that in order for you to see that true change, you need to have a patient advocate. If your provider is busy seeing patients, but bringing in the right people to be that champion to support not only you, but the patient is going to be so imperative.
Yeah. Yeah, no, I mean, and it's like healthcare is local, right? I mean, I
Yeah.
think over the years, convening folks, one of the things I've learned is, and you'll hear it, you've seen one hospital, and
Yeah.
I think that's becoming less true, maybe a little bit from a system standpoint, although I'm sure most CIOs would disagree with me. But when you think about the communities you serve and what that means, what does population health really mean, and taking ownership of that for a health system and the payers in the community. I mean, and of course, every community, there is a different payer mix and a different provider mix. And, it doesn't replicate even in California where Kaiser has a huge presence. It's still unique, even based on zip, right? I mean, and it is zip code based very much. And so that whole shift to social determinants of health and how to look at that does really impact both the provider and the payer at that same point. So, you've talked a little bit about kind of equity and where that fits in. And of course, as Medicaid and Medicare markets shift, tell me a little bit about what you're seeing in terms of what the provider, I think in the very beginning of the social determinants conversation, providers said, are you kidding me? Like, so now I've just got to collect a whole other bunch of data and think about that. Now, so has it shifted? Like where are the payers and providers coming in on this now? Like you mentioned food as medicine and some of those, and I know there's some cool programs out there. Tell me a little bit about what you're seeing.
Yeah, I think now is a great time where there's more emphasis on health equity, right? This should have always been the case, but at least it's happening now. And we went from having in the beginning a misconception, certain patients in certain areas don't have access to technology. That's not true. Even the homeless populations that might be on Medicaid or Medicare, they have cell phones. But what we need to do is connect them to charging ports, connect them to areas where they can be able to still see their physician and even exercise as medicine. I think that's where we're seeing a lot of improvement in the programs and the offerings. There are a lot of amazing partners in the behavioral health space, because we know that is very critical. That is very key, especially in terms of underserved communities, because sometimes mental health exacerbates hypertension, exacerbates diabetes, a lot of the chronic conditions. So we're connecting groups and connecting patients to great solutions within the behavioral health landscape. They're able to work with partners, or providers are able to actually prescribe exercise as medicine and connect them to a program that allows them to exercise in their home. Food is medicine, right? And I always make this joke that when people are wondering why all of these issues are going on and finding out, okay, well, why are these patients having strokes? A nurse actually said to the team that came in there, well, this is the South, fruit is baked in a pie and vegetables are deep fried. So when we think of food as medicine, most people used to offer groceries. Food as medicine is now shifting that to where you're actually learning how to create food that aligns with what you want and what you need, things that actually improve your health, that build that partnership and that relationship with your care teams, and puts you in the driver's seat as a patient to how you're able to even transform your health outside of that visit. So I think underserved communities are now getting the support that they need, but there's still so much more to be done. And also providers are missing the awareness to a lot of these solutions. There's still a lot that may not be on that site or need to be connected. And one thing I will say is that a visit where a provider actually can look at a patient and talk to a patient can still start to improve a lot of that health inequities. Because when we think of it, what is a non-compliant patient? Is a patient that is lacking resources, right? I always hate that name. Non-compliant patient, no, that's a patient who was always taught that their health doesn't matter, right? Who never understood how to improve their health or felt as though that they were being rushed out of the room. And I think how AI is starting to improve that patient experience and improve that relationship between provider and patient, that AI scribe solution, right?
Right.
We're still in the first phases of it, but Heidi Health is one that I love. They are offering a free AI scribe solution. So imagine you are a provider that sees mainly Medicaid, a true underserved population. Imagine not having to look at the screen and you can focus solely on that patient. And you don't have to worry about, let me invest in all of these, very expensive tools. You have this partner helping you to focus on building that relationship. Because how do you improve health? One, by building trust. And then from there, that's how everything is transformed. So I think a lot of good things are starting to happen from that health equity side that I'm excited to be a part of. But I know that there's still much more to come and much more to do. Yeah.
Well, absolutely. So much more.
Yeah.
And I mean, and I love that in our last few minutes. I mean, I think that that vision of, the technology where it is, sort of a lower bar of entry, it's less expensive, more affordable to the providers for them to implement and use. And I think that, one of the critical pieces there is trust. And I think, where healthcare has lost the trust of some of the population, technology has lost the trust of some of the providers.
Exactly.
And it's how do we rebuild that trust? And where are some of those opportunities where we can have more of an impact on the population? So, in terms of just, I think you mentioned one right there, but are there other kind of, to leave us with in terms of those opportunities for both providers and payers to really work together to get some of these technologies, both, in the hands of the patients to then improve that trust and ultimately that engagement, right? Because that's what, in terms of a patient, a non-compliant patient is not engaged, right? So what are some of the most promising areas there?
Yeah, I think that's definitely a great question to end with, just because there's so many amazing solutions that are coming out, again, with food as medicine, exercise as medicine, and digital therapeutics. But I think with these vendor partners, the providers, and even the payers, we need to think about what care looks like for the patient, right? If we're truly patient-centric, we need to go where the patient is, and things need to be structured. From the vendor and the payer side, I would say that we need to start looking at what it means to support rural communities, what it means to support FQHCs, free clinics, right? The independent primary care, because medical groups and health systems, they have the infrastructure, right? And we're focused on building those up because they are doing a lot of good to serve vast and diverse populations. But we need to make sure that the solutions that we're investing in, and making sure we're actually investing in solutions that support those groups that require that extra bit of love and care. So I would say that's where we're at, just bringing more awareness to community partners, right? Incorporating digital innovation into how our communities advance care. Doing a better job of connecting community groups to these digital health innovations, as well as bridging the gap between provider and communities, and bridging the gap between community partners, digital health partners, and payers, because that's where we're going to see the change, because it does take a holistic approach to improve care. And that is where I see digital health innovation truly benefiting, by closing the gap and connecting all partners.
Yeah, no, absolutely. Well, I love that. And thank you so much. I mean, and I think that piece of where digital health and these interventions can truly impact those who need them the most, not just the worried well, but those who need them the most, and create the connections between those who have been, had less access. So thank you for sharing that with our audience and all the work that you do. I love that we've connected and look forward to working with you. Tell our audience where they can contact you.
Yes, you can find me on LinkedIn. My name is Nzinga Lowe. To learn more about Pygmalion Health, you can go to pygmalion.health, or you can reach me by email, nzingalowe@pygmalion.health, to set up some time to learn more about what we're doing.
Perfect.
Thank you, Megan, so much for that.
Thank you too. And until next time, keep exploring the exciting world of digital health, and remember that together we're shaping future and making an impact. This is Megan Antonelli. Thanks for tuning in.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactlive.com.